All right, so we are going to get started. Thank you so much to everyone who's come in today for our obstetric violence panel. My name is Magdalene Lederer. I am a rising fourth year student at Rowan Virtua School of Osteopathic Medicine in New Jersey. I am currently pursuing applications for residency in 2024 in obstetrics and gynecology. And so I'm really excited to bring this topic to the forefront of our conference today. Obviously, obstetric violence affects those who give birth, their support partners, birth workers, and mental health clinicians, and we want to highlight that today. So as we get started, I would like each panelist to go around, introduce themselves in a sentence or two, and then we'll get started into the questions. So we'll go alphabetically. Andrea, you can go first.
Oh man, I thought I was gonna go second. Hi, good afternoon, everyone. My name is Andrea Clark-Horton. I am the director of the Perinatal Mental Health Alliance for People of Color, and we are a program under the auspices of Postpartum Supportum International, which is an international organization that provides peer-to-peer support for women, birthing people, and their families and partners experiencing perinatal mental health disorders. My program focuses specifically on doing awareness and education around how perinatal mental health disorders show up in the bodies and minds of folks of color. And we also do professional development and support for providers who work in this space. So I am delighted to be here with you all today.
Great, thank you. Kristen.
Hey, I forgot about the introduction. So my name is Kristen Piscucci. I'm the founder of Birth Monopoly, and I got my start as vice president of Improving Birth, which at the time was a national consumer advocacy organization for better maternity care. And obstetric violence just jumped out at me immediately as a huge issue that people were not talking about publicly. And so I've spent the last 10 or 11 years just trying to get the stories out of individual bodies and brains and into the community, into the media, into the public, sort of consciousness. And yeah, so that's me.
Thank you. And then Chantel.
Hi, I'm Chantel Pipkin. I am a birth worker. I am a birth doula, childbirth educator, placenta encapsulator, and I'm also a midwife assistant. I've been doing birth work since 2017. I established Womb Sister in 2018. Since then, I've done 83 births. That is so exciting in the birth world when you start breaking records like that. And I also created an annual women's wellness event called Womb Fest. Thank you for having me.
Thank you all so much for that. So our first question is going to just everyone give us your definition of obstetric violence, what that means to you and what that means to the people, the clients and patients you encounter.
I actually want to defer to Kristen to start because the place where I was going to start is borrowing from something that she's already said, and then I'll add on.
Oh, okay. Well, I feel well prepared to answer this question, actually, because I actually just released a course on obstetric violence. And when I just had in my little outline, okay, how do we define obstetric violence? It turned into like a full 2-hour discussion. How do you define obstetric violence? There is no universal definition. I think what we often, sum it up as is mistreatment and abuse and disrespect of birthing people or in the perinatal period. Venezuelan law has a definition that includes the word appropriation, which I think is really fantastic. Appropriating the pregnant body by healthcare providers, over medicalization, abusive medicalization, I think is maybe a better way to say that. And another word that comes to mind for me is submission, is that there's this expectation that the birthing person submits to, basically just the removal of their agency and, to the benefit of healthcare providers, healthcare facilities, and all the policies and, all that stuff that outweighs the best interests of, an individual birthing person. Oh, and I forgot to mention coercion. I'm so sorry. Coercion is a huge part of it. Sorry.
Chantel, go ahead. I mean, I don't
Oh,
want
okay. So I would describe it as anything that makes you feel uncomfortable, anything that makes you as a patient at the time, anything that makes you feel like bullied in a way, like your rights are being limited. And normally what I would also like to say is it's usually just from kind of like leadership. We look to doctors, medical providers, nurses, everyone. We look to these facilities and people. We honor them and we honor the things that they tell us. So it's usually like abusing your power, abusing your power, abusing your role to force people against their will. And if you as a patient, a person, individual feel like you can't say no, you feel pressured, you're just uncomfortable, you are going through obstetrics violence in a way.
So to add to what the wisdom of my co-panelists already, one of the other things I wanted to pick up from something that I've seen, Kristen's website on Birth Monopoly, she points out it usually being verbal, right? And so when we think of violence, I think in the context of the United States, we sometimes think of it being actual physical harm, which I think that this can include that. But then there's also this, and to pick up on Chantel was saying about abuse, it can come verbally, right? It is usually normalized as this is how we care, so even the tone of voice is this is normal in healthcare. This is normal in a birth or a delivery. This is how we, this is how it's done. The other thing that occurred to me as I was thinking through this is not just what's actively done, but it is what is not done. So neglect is part of this too. And so that verbal delivery is not necessarily just this forceful or disrespectful use of words, but it's the lack of hearing me, right? It's the lack of screening me to see how I'm doing either before or after birth in terms of my mental well-being. I think all the time, and I use Serena Williams' birthing story as like a centering point for this for me, because she's someone who knew her body and knew that she had a history of blood clotting and was telling her doctors after birth that she was not feeling well. And so it took everything, she could have died in that moment, but she was not being listened to. And so when I was a hospital chaplain for 6 years and I worked on the mother baby units, right? And so a lot of my job also involved training staff and trying to sensitize them to the emotional and spiritual issues people experience as they're going through birth. And I use her story as a centering piece all the time, because I'm like, if Serena Williams can't get you ought to hear her. Then my mom, who's a Medicaid mom here, who's delivering, like, imagine how she feels, how invisible she feels in this predominantly white institution, right? And so for me, it's about as much as what's done as the ways that we neglect to hear the voices of people during the birthing process.
Thank you so much. And thank you for bringing in Serena Williams' experience. I think that really confronted a lot of people when an Olympian a millionaire, like even someone with a white husband still wasn't listened to. Like if she's not listened to, who else is not being listened to? And it's, I mean, I'm so glad that she was willing to put that story out there so that we could hear that, but she also shouldn't have to, like that, it shouldn't have happened. It's a really tragic story. So I'm grateful that we're here to center this conversation today. So moving into more the patient client side, how do you recognize if someone has experienced obstetric violence, particularly if you're on the mental health side, you weren't there, you weren't the doula, you weren't the nurse, and maybe even if they haven't fully said that they had a traumatic or violent experience, what are things that you start seeing that lead you in that mindset? Anyone can start.
I would go, okay.
Go ahead, Chantel, go ahead. I just
I
got
would go off of like just from experience. Even as a doula, sometimes people think it's just for first time parents, but a lot of times I get second time, third time moms. And when I get them, they're usually coming to me because they want to change or because they felt like they weren't as knowledgeable for their first birth. So they would like to have some type of advocate. So normally when I start off with my clients, I tell them to, well, if they're not a first time mom, I ask for them to tell me about their first experience and tell me the things that you liked, the things that you don't like. And as they start to talk and open up, you start to realize that they're mentioning certain things that's uncomfortable or things that they really, really want done. Like, I really want to be heard and I didn't feel seen and I don't want certain words to be used. And, or some people have fears towards just certain things like episiotomies and stuff. Like if they start listening triggering words and they start having shut down feelings towards it, they have experienced some type of violation.
Yeah. Yeah, I think I was going to say the same thing. For me, it's like, it's listening and hearing the stories, right? And listening to, I've been listening for the last couple of days for some reason, both in the context of my job and in other contexts, like women sharing stories, their birth stories, their perinatal like journey, pregnancy journey, and postpartum stories, and about just how, especially in the areas of mental health, like they knew something was wrong, but either nobody asked them or they didn't feel like themselves and nobody asked them in terms of their providers, or nobody screened or made any recommendations, or they were kind of told to suck it up, like this is just what happens when you have a baby, right? And so that in itself is a violent response. I think the other thing that helps you to recognize when there's been an abuse has happened is, as folks who work with these populations, like you have to be familiar with the systems, right? And so you need to know how the systems function. You need to know what is available for folks to have. You need to understand patient autonomy, right? And so so that you can recognize, even when a patient doesn't, that their autonomy has been usurped. You need to recognize, you need to kind of know things about like insurance and what insurance will pay for and what insurance won't pay for, right? Not everything that you can't be a content matter expert in everything, but you have to have some ideas about what systems are supposed to offer, how they work together, and what the limits of the systems are, in order to be able to help people navigate, so that you'll have in your mind, like, this is usually what is supposed to happen. Like you really should be able to stay in the hospital for like 4 days or 3 nights, 4 days if you had a C-section. They shouldn't have told you you have to leave the next day if you're not feeling well. Like, so you have to have some kind of idea that, and to help people to, but by listening to their stories, you are able to really help help people identify where they've been violated.
Yeah, I was going to say the same thing, listening to stories. Yeah, it's pretty apparent. I guess the only thing I would add to those were comprehensive answers is, just because I know we have medical providers watching, is that it's not, I would say it's more common than not, you know. I'm sure people, I know that providers think of obstetric violence as a rare thing, you know, that that impacts, a handful of people out of a group. But in fact, I think, like I said, I think it's more common than not. And it can just be in some very subtle ways. I'm sure you've heard people say, I wasn't allowed to eat, or they wouldn't let me get out of bed, or, they wouldn't let me go to the bathroom. Those are subtle things, but those pack a punch. I mean, those are human rights violations. To deny somebody water, or not water, food and sustenance, to be able to have freedom of their own body, to get out of a bed, to move around, to go to the bathroom, to vacate their bladder or whatever. So I think it's just a lot more common than people think. And like we all said, listening to people's stories, you'll hear it more often than not, I think. And it's not necessarily traumatizing to everyone. Those things aren't, there is overlap between, trauma and violence. It's not 100%, but there often still is that obstetric violence, even if somebody isn't necessarily traumatized by it.
I also want to add that I think in general, healthcare providers, any type of support pertaining to childbirth or just women's health, I think that also trying to hear more about women's lifestyle. Obstetric violence, yeah, it can be limiting people's rights, but we also need to understand that a lot of individuals go through different things, and something like a touch or can trigger somebody than opposed to somebody else. So like a person who has been through sexual abuse, violence, or something like that will be triggered by a touch and stuff. Like there's so many different things that affect people. So you really, when you're taking on a client, a patient, you really want to ask broad questions and really listen with an open ear so you can figure out what are some things that may trigger them or make them feel like their rights are being taken advantage of or they feel limited.
Mm-hmm.
Thank you. And I appreciate you saying that obstetric violence is more commonplace than we think, Kristen. Even for me, I recently did my obstetrics rotation, and just the normalcy of just having a woman's bottom exposed for hours on end, not covering it in between pushes, nothing, just being exposed like that. A lot of women don't like that. I mean, some women don't mind, truly, and it won't traumatize them. I would not feel comfortable like that, and that's normal. I was actually given a look when I continued to repeatedly cover a woman's lower half because it did not. There's no contraction. She was just sitting there. Why do we have to have it open in full view to a door that could open? And I got some nasty looks, and a woman, like a nurse, was not happy with me doing that. So, I mean, and that is just because it's common and no one has challenged that in that institution.
Can I add something?
Yes, please.
I mean, I think that's a really good point to make as far as the definition also, because what you're describing sounds like a loss of dignity to me. And I think that's an important piece of it. Especially, I mean, dignity can mean a lot of things, but I'm a sexual assault survivor. It's going to impact me significantly if I have to lie there with strangers walking by my bare ass. Like, that is not okay on any planet. And like you said, some people, it doesn't bother. I mean, and I've had conversations with plenty of people who are like, oh, it doesn't bother me at all. They're just doing their jobs, whatever. Well, that dignity, which is such a sort of, amorphous thing, it has such an impact. It has such different impacts on different people. So like Chantel was saying, you have no idea what people's backgrounds are. And you cannot just assume that because somebody did not walk up to you and say, by the way, I'm a sexual assault survivor, can you give me a little extra care and a little extra attention, a little extra dignity? I mean, I think that's a really, I think keeping that standard really high as far as dignity, that should just be for everyone, right? Because we don't know we have no idea. There's no way we could get everybody's histories. And a lot of times people aren't even aware of their own histories. They have no idea what might trigger them, or something might trigger them for the first time ever that they had no idea was going to trigger them, you know?
Mhm.
So, yeah, I don't know. I just can't emphasize that enough, that I guess we're talking really about a trauma informed approach, that everybody should be treated as if they are vulnerable to re-traumatization.
Yeah, especially I mean, we know that trauma affects people more in great hormonal change states, some things like puberty and pregnancy and birth, where there's where you're supposed to remember it. You're supposed to remember the birth of your child, but that's even greater if it's a negative experience where your dignity is removed from you. So I just want to continue as we're getting deeper into this conversation. For those listening, there, I would like to put a trigger warning that things like sexual assault are inherent with obstetric violence, and this is a wonderful conversation, but if it's getting to you in a certain way, we want you to leave. Like, please do not feel like you are required to be here, because it's important. Take care of yourself first. This information is out there in many different ways that might be more easily accessible for you at the time that you're in right now. So moving forward, I have a two-part question. So how does witnessing obstetric violence affect, first, like, partners and parents, and then second, birth workers, doulas, nurses, midwives, even like residents, medical students, doctors? How does it affect the people whose child it is and the people who are all working in the space?
I think we're both waiting for Chantal.
So y'all waiting for me. Okay, so how does it affect, well, first off, how does it affect families? You have to understand that babies coming into the world, for the most part, it's a blessing. It's exciting, especially if it's a first time thing. So for mothers and grandparents, aunties and everything, everybody's excited, but they do not want to hear that something may be possibly going wrong. So if anybody feels violated or going wrong, you instantly see like a shutdown towards the family. But as for partners want to be they're like providers and protectors. They're there to listen. So a lot of times when it comes to the obstetrics violence, they are pushing partners to the side. Sometimes they make husbands, I'm going to say wives as well, feel as if they're very little. And sometimes we need to realize that pregnancy, yes, you have that person who is pregnant, but I always tell my couples, y'all are pregnant. Because a lot of times the partner feels left out. They feel a little bit less than, and they have a voice. This is their baby too. So when stuff is taking place and it's happening, or if they just don't feel equally respected or appreciated, they too end up going through some type of violence. Like, if there's plenty of times I have fathers, I do same-sex births as well. And a lot of same-sex couples, they instantly feel violated from the beginning because they don't feel equally respected, because it is not a husband and a wife. So the way that you approach a couple means a lot. And just because that person isn't walking around with a baby bump, still addressing them, asking them if they're okay, asking them if they understand what's taking place, or if they have a question, actually taking the time out to answer their question means a lot. As for birth workers, we're in that room at the same time, and we're still there trying to have a safe, healthy birth. People within the gynecology world and stuff, a lot of times they don't like doulas. And sometimes they say, like, we're too boisterous. Sometimes they feel that we're telling patients not to do what they want. We're here to help them advocate. We're here to give them knowledge. And sometimes I could tell you just like this, walking into a hospital, opposed to doing a birth center birth or a home birth, I instantly feel guarded. I feel guarded because sometimes we have the slander of we're bad and we don't get respect. Oh, they're not nurses. Why respect them? Or they don't know much. It is violent towards us, especially with being a birth worker of color. You're already trying to advocate for women, and then you come in and they treat you less than, and you feel not as important. Sometimes if they think, not even if you are doing, if they think that you are misguiding someone, there's times where they may try to call security on you. I've been threatened. And then you don't also realize that not only does that patient goes through trauma, but as a woman, we do have birth workers who are men, but as a woman watching somebody being violated, you feel violated too. And sometimes you're sitting here going, could I have done something? What could I have changed? Should I have spoken up some more? There's a lot that goes through, and I have stories, but I'm going to let everybody else speak. And if you want me to share more, I will. But that's what I have for right now.
So I think having worked both in a hospital, well, sometimes I was in the room during deliveries. I've been in the OR during C-sections as a chaplain. But I think part of as I said, part of my job was supporting the other members of the medical team. And part of the fatigue I think that I see with obstetric violence comes from the same source that I think it can, the same way I think it can affect partners and family members, is this sense of like helplessness, especially if something goes wrong that is not the fault of the medical team or the parent. You know, sometimes things just happen. And I worked at a large hospital in the largest hospital in Illinois. They did the majority of the deliveries and births. And so we had the majority of like the of losses too. Like, and I work a lot with those families. And so being witness to that over and over again does also take a toll. But I think as Chantel just said, especially for birth workers and medical team members of color, and especially for those that might be more junior, newer to the profession, or they're still students or whatever the case may be, it's witnessing something, it's this sense of moral distress, right? Like witnessing something that you feel is ethically and morally not in alignment with what you've learned or are learning, or even your personal ethic, and somebody being mistreated in a way, but you feel not only helpless to stop it, but like trying to voice it to people who have some power to change how things are done. You sometimes feel like you're running into like a brick wall, like nobody wants to hear that. And that has a weathering effect on medical providers and birth workers. I was going to say one other thing about I think that what Chantel said about the partner's voice in the space is like very, very, like, it's just so on point. And it is already the couple that and I understand that a lot of times that the system views the woman, and then the woman or the birthing person and the baby as the patient or patients. But your care has got to extend to the entire family as a unit, right? And part of that care, though you're not caring physically for the body of the partner at that point, what you are caring for is their emotional, like this can be a highly stressful, and though exciting, and it's not always exciting, because everybody's not always happy that they're having a baby, right? But this can be a highly emotional, stressful, fraught situation. And so to further like neglect the needs for support of the partner is that can be traumatizing, but that definitely can be a violent response. They're there to try to provide support for their partner in whatever way they can. And so I think acknowledging that, and acknowledging not only their presence, but having them be included in the ways that you can is a way to mitigate that.
So I think I would just add two things to everything that you all have said. One, I think really says it all, which is that I can't count the number of doulas who have said to me, I felt like I was witnessing a rape. I felt like the expectation was my job is to hold that person's hand while they're being abused. And that is traumatizing. And then on another note, I think that one of the things that struck me early on in this work, because it was personal to me when I was pregnant, it was a traumatic pregnancy. I did not want to be pregnant. And I was really concerned about bonding. And I was terrified that I was gonna hate my baby. And, most of me wanted to love him and felt felt that duty and that responsibility and that whatever. But then there's this big part, right? This big part that's, what if I just don't, what if I, whatever. And there's all this guilt and all this other stuff. And so, and I'm not making this about me. I just want to make this point. When I was doing my pregnancy planning, I knew that absolutely top priority was not interfering with that bonding, with that attachment with my newborn. And I saw when I started getting into this work immediately after he was born, kind of my worst nightmare, which was that one of the just most devastating impacts was certain, not everybody, certainly not everybody, but that for some birthing people, it was an immediate, I don't want to say break of the bond, but, just a negative impact on the bonding with the baby. And when you think of the guilt and the horror that you feel as a new mother when your baby is your trigger, this new being that you would give your life for, and it is such a conflicting feeling, right? To be like, I would die for this baby, and at the same time, this baby is a trigger that is putting me into, maybe PTSD symptoms or, whatever. And I think that is just that can be a really long lasting, absolutely devastating effect. And it's largely so unnecessary. And to me, that's just heartbreaking. Because there's no getting that back, that's.
Yeah, the violence of, the violence of immediately taking a child from its mother and doing all the things right away because we have to, because it's the list. I mean, and especially if something fairly traumatic has happened and you're like, mentally, I'll just do this because I'm going to get my baby. And then they take your baby. That is obviously changes that need to be made in our system, because I agree the bond isn't broken, it's not forever gone, but it's so much harder. And it, lends towards postpartum depression, postpartum anxiety, PTSD for future births. I mean, it has such massive effects on the dyad of mother baby. And
I want to correct myself. A minute ago, I said, there's no getting that back. I didn't mean the bond. I meant that time. I meant there's no getting back that time. And it is possible to heal these things. It is possible to fix these things, and they're actually so healable. And yet I think most people have absolutely no idea what those resources are, or, even that that's possible. And that I think is really sad.
One of the other things that I meant to say in the way that I've seen this affect birth workers is I don't know how to put this. You get either so used to observing the way or seeing the way that this kind of violence and abuse, it becomes a normalized part of the process that and either you get tired of trying to fight against it and change things, or you just feel helpless to do that, and so then you start to repeat it, right? It starts to become ingrained in the way that you practice too. And I know how busy, birth workers are and the medical team is when they're working to help bring, a baby into this world. I know how you're not just doing one baby at a time. Usually there's other things going on, but I think that reinscription of the narrative of this is just how we do it is a way that a lot of birth workers and members of the medical team have learned to cope with that repeated violence.
Is it okay to share a story?
Yes, totally
So,
okay.
because even talking about this, like I feel my chest feeling tense because I think about this situation. So, one of the ways that I experienced obstetrics violence was I had a client, first time mom, and she was so boisterous of all the things that she wanted. How involved she wanted her partner to be, the communication with her doctors. At the time, she was a person who ended up booking closer towards the end, and she stuck with her provider. She did mention that she didn't always feel 100% heard, but she was okay. She wanted to birth at the hospital that we was birthing at, and it was a well-known hospital in New York. So, needless to say, because of it, I said, you know what? We are going to birth as long as possible at home, get your body up and moving. As long as you are safe and healthy, we're fine. So, we're birthing at home. We get her moving. Her labor is picking up and going. We get to the point where she's like, Chantel, this baby is coming. So, we're driving into the hospital. When we call, they told us at one point, it was like, oh, yeah, you can come. We called back and let them know, like, it is picking up, it's very close. They were like, oh, okay, come, but we don't have space. So we got there and we spent a lot of time in triage. But now it got to the point where this baby was like, I'm getting ready to come out. So they gave us like kind of like a postpartum type room to birth in. They brought over the monitors and everything so she can be monitored. So I'm telling you, there's no major dips, accelerations. Everything is really going good. And if there wasn't a dip or accel, it like popped back perfectly fine. Everything was going great. She's getting ready to push. It's even to the point where the doctor, because the way the room was like, it's okay. You can stand on the side of the bed, squat a little bit and push to get the baby to come down more. And then we'll get on top and, birth. So she did all that. Baby's getting ready to come out. So the doctor is like, okay, comfort her. And she's like, she wants to check. So I'm in my head, I'm like, she wants to check. Like, I see it. Cat is getting ready to crown. What do you need to check for? So anyway, I'm like, it's okay. I'm going through the breathing with her and everything. I start to see her fumble with scissors. So I mentioned she does not want an episiotomy. Like, no cutting, please. If she tears, she wants to naturally tear. And the doctor's like, okay, yeah, no problem. And then she's just like, because my client is getting towards the end, and that fire, the ring of fire. I hate that phrase because who wants to go through that? The ring of fire. So the ring of fire. So I'm like, I'm talking to her now because now we're having this sisterly vibe. They don't call me the womb sister for nothing. So I'm sitting over here and I'm like, okay, this is the moment. You have to get all your courage and you have to go forward. And so the doctor's looking at me and she's realizing that my client really has like an engagement. So she's like, yeah, look at her, talk to her, hold her hand, get her to calm down. So I'm like, okay. So I'm talking to her and I'm like, okay, let's breathe and everything. Out the blue, all of a sudden, I'm not even looking at her now because we're getting to the point and I'm like, slowly push, open up. And all of a sudden I see my client's eyes get like this big and she screams, what are you doing to me? While she's doing this, she's grabbing my shirt. And she's like, what's happening? And when I look down, this doctor cut her. Not only did she cut her, you see, I am certified sterile technician for the hospital as well. I've been working in the hospital for well over 10 years. And she used bandage scissors on top of it. She did not use regular cutting scissors. It was bandage scissors. Bandage scissors are used for clothing, bandages. That's why it's called bandage scissors. And so she used the wrong scissors. And I'm telling you, when she did the cut, I still till today remember the sound that it makes. Like, even when they're doing landscaping and I'm walking outside, like springtime, if I hear them cutting the hinges and stuff, I cringe because that's exactly what it sounds like. And she screamed and she was crying. And the baby came out and the doctor looked at me and said, it was a medical emergency. We had to. The baby came out beautifully colored, not even like needed a second to breathe. We didn't have to do no rubbing and stuff. Like, I mean, beautiful. And why was it beautiful? Because we were breathing. She had all that oxygen. She was breathing. And at that moment, I realized that I was used.
Mm.
And my whole time going home, I felt like, is she going to think that I was a part of this? Like, is she going to think that I set her up? And then like the trauma that she had from it and the amount of stitches that she had to get, they didn't give her a chance to even tear. And I kid you not, I was petrified to go into the hospitals after that. I got goosebumps on my arms just talking about it. I was petrified to go into the hospital. I was doubting myself as a birth worker. I felt used. And then the biggest thing inside was I was wondering, did she think I did this on purpose? Because at the time she looked at me and said, breathe with her, hold her hand. And I did that, and she waited till my back was turned because she knew I was watching, and she did that. And after I saw my client, for your postpartum visit, all she could do was thank me for being there, and she was so happy to have me. And at that moment, I was like, "You are?" Because I was so alarmed. And even after that, I didn't want to do births. I mean, hey, you guys gonna know my name and everything. I don't wet the bed now, okay? So don't y'all go spreading rumors. But I literally, grown woman, was wetting my bed every week because I was having dreams and just would lose it. The thing that ended up saving me, like as a resource, was something called havening. I went to a midwife assistant course, and there was other midwives there. And they were talking about the sense of havening. It's like the new study where you talk about the things that trigger you and you replace it with different things, like kind of like hypnobirth in a way. You're going to replace it with different sounds, different touch, things that make you happy. And they made me talk about this. And as I was talking about it, the goosebumps, the tension would come. I was crying. And then they had me do different breathing exercises and add different imagery. And actually it was done because I was like, this is not going to work. After that session, I was actually able to sleep and not wet my bed. And then afterwards, I kept on going through some more sessions. And then I felt empowered again to go in and be a better birth worker. And then after that, I just became a little bit more stern in my craft, because I just never wanted to ever feel like I was used as bait to do something to violate another woman. So I might be a little bit more boisterous now, but that was something that really impacted me, and I'll never forget it.
Yeah.
Never, ever will forget that. So yeah, that was definitely power being abused. And then later on when I spoke, because I actually worked for that hospital for 7 years. So I spoke to other people who worked there, and they told me, oh no, she's known for this. Like, no matter what, this is just her practice. She likes to give episiotomies because she feels like it will be a easier cleanup and stuff. And that was just her practice. And that to me is just alarming. And it probably triggered me more because when I was going through my childbirth, my mom, I don't think we realized that women, I want to say women, but also women of color, we carry on the traumas of our mothers, grandparents, aunts, everything. So those birth stories mean something. And when I was pregnant and you go to your elders to ask, how was pregnancy? Like, what's going on? And my mom was just like, oh, you to get an episiotomy. You have to. And I was like, why do you have to do these? I had to look it up and I was like, oh my gosh, why do you have to do this? And she was like, that's what they did in the 80s. Like, that's just was like the instant practice. You had to. And it got to the point when I gave childbirth and I was getting ready to push, my labor was going great. I was getting ready to push. And then I said, you know what? I don't want to do this no more. And my doctor was looking at me like, what? I was like, no, give me a C-section. I don't want to do this no more. And she was like, Chantel, you're doing great. And I was like, no, I'd rather just get cut this way. Don't cut me down here. And she was like, wait a minute. Why do you think I'm going to cut you? Thank God for Dr. Powers. I don't know where she's at, but Dr. Powers, thank you for being you. She was just like, wait. And I called it magic juice, but now I know it's like mineral oil and lubricant and everything. And she lubed it up and she was just like, breathe. And I had a beautiful birth experience as an unexperienced first timer. And I feel like that was just luck. But I had my baby, no rips, no tears, thanks to her from seeing me so triggered, because here I am pushing and she's like, you're getting ready to crown. And I'm over here with my hands in between my legs, like, no. And she's like, whoa, what are you doing? Her seeing the fear in my eyes, it could have went left because not everybody care to like say, let me comfort this person. But she didn't want to be that person. And she comforted me and I was able to have a beautiful birth experience. But that probably was another reason why that my client's birth triggered me so much, because that was my fear. And that's exactly what happened. And I felt used. It was awful.
Thank you for sharing that, Chantel. I mean, unfortunately, that is one of many stories. I think that we have made pretty clear that, I mean, Kristen's heard from doulas. I've heard from doulas. I mean, this is the reality of obstetrics, at least in the US right now, but potentially even internationally, just the paternalism that exists. And the using of a doula is very disgusting to do that to someone.
That is so nasty.
Yeah.
That was so nasty of that doctor to use you like that. Like that is
exactly what you did.
Wow.
And I was so triggered. Like I even after like embracing my client and I might have stayed with her almost 5 hours afterwards, because I was just like, I felt so bad. And then like my whole time going home, I was just like, I felt so used. And like, I'm like, how dare you tell somebody that you're here to advocate for them, to help them, and to let them know that they have the right to say no. And to top it off, her partner was like, no, she does not want this, no. And they did it anyway. So not only did she feel violated, he felt violated, and then I felt violated. It was just a bad experience for a birth that actually was really beautiful, because naturally her body was opening up, baby was in beautiful positioning. It would have been if she probably would have just gave her that chance, it could have went different. It really could have. And I speak to her all the time. Like I have great relationships with my clients. I speak to her all the time. And sometimes it's so funny because now that our baby is turning 4, she's ready. She's starting to say stuff like, I may be getting ready to try for another. And she's like, and I need you. And I'm like, wow, you still want me there. And part of me is very nervous because and look at me, I didn't give birth, but I was there. And part of me is so nervous to be at her second birth because I just want to do it right. I just feel so bad that she had that experience that I want that second birth to be. I'm a second away from, if she tells me she wants a midwife, I'm a second away from paying for it myself, just to make sure she can have like a different experience. I feel compelled.
So I also really appreciate that you spoke about what you used to help heal from this, because it's not enough just to acknowledge that people in the birth space are experiencing trauma, but also how we work through it. Because as you can tell, I mean, a lot of nurses, doctors, I mean, doctors are highly traumatized in residency and they're expected just to go back to work. So, I mean, it's a lot of traumatized people taking care of people in their most like beautiful, wonderful day. And so I appreciate you talking about the havening. For our last question, I'd love for each of you to speak about what our options are for healing, both as, you know, people having children and their partners, as well as birth workers, as well as what our rights are for reporting these kinds of things, which I know you have worked on quite a bit, Kristen. So what healing and moving forward to keeping this from happening again, at least in our space, looks like.
So I can start with answering that question. So Postpartum Support International, as I said, we provide a lot of peer-to-peer support. And so what that means is that we have volunteers, but we also have paid staff who facilitate virtual support groups. And so we have support groups that cater to different demographics who've had different experiences. We are starting, I believe it started this month or starting next month. We have 2 groups dedicated to birth trauma. And so we have one that's a support group for survivors of birth trauma, and one for people of color who've experienced birth trauma. But we have support groups that are catered to different variety of experiences that touch on the perinatal mental health of women birthing people, their partners and families, from different racial and ethnic backgrounds, from LGBTQ plus families. And so finding those spaces is one of the ways. In terms of support for providers, one of the things that we started in my program in particular, for the Alliance for People of Color, we just started a professional peer mentoring program. And so what those spaces are designed to do is not only to help people collaboratively prepare and get some professional development opportunities in terms of studying for licensure and like perinatal mental health certification, and things like that, but also to be a space where you can decompress with other folks who have been in the birthing space, or working with postpartum families, or reproductive families having reproductive mental health issues. They've been doing it for a while, but they're also still doing it. And so you have the ability to talk through, process, and decompress with not necessarily about the clinical, like as therapists will sometimes do peer supervision and clinically go through cases to talk about, you know, different clients. No, this is a space just for you to decompress and talk about, this is what I'm feeling, even this is how I'm feeling in my body, and how we share as a community. A lot of folks of color are communal people, right? And so the way that we learn and share information, and the way that we heal is a lot of times in community. So for you to have a community of folks who can relate to you, and then who can share suggestions for how you take care of yourself. Beyond self-care is such an overused phrase, I think, and such a misused phrase. But also, how do you care for your spirit, your emotions? I'm a big advocate that every therapist, every birth worker, everybody I think in the world needs a therapist or a counselor, right? I know that that's not there are different modalities, And so trying to find the ones that work for you, but those are some of the immediate thoughts that I have.
Chantel, you want to go?
Oh, I thought I gave, okay, so well, I'm a big advocate for havening because havening really did help me out. I would do that, obviously therapy. Within the birth community, we always try to find some type of support group. Like we have groups for some type of violence, we have groups just for new mothers. Me as a doula, I usually always go back and you sit down with them, you ask them, because just because you think their birth went well doesn't mean that it was beautiful for them. So I go back and I ask them, like, tell me how you feel about your birth. Tell me how you've seen your birth, because I've seen your birth through my lens. Tell me how you see your birth through yours. And then after that, I also ask them about what's happening in the household, because sometimes, you know, yes, there's obstetrics violence and stuff, but sometimes parents, families are way more abusive with words and stuff because they feel like they know how to take care of a baby and how you're supposed to take care of your body. So sometimes I just ask that woman that self, like, how are you feeling? Are you being supported by your loved ones? What do you need? How can I show up and help you? What is it that you need? But right now, this is kind of, we're at a stage in life where I feel like we are changing things up and breaking the norm. And this is something that people aren't aware of. So, you know, like a lot of people don't even know what to call this and stuff. So currently right now, even this conversation, being able to have these conversations, bringing awareness to these things, this is how we bring some type of change. You have to have uncomfortable conversations to create a change. So this today will bring a change, especially if we're having conversations amongst birth workers, new moms, future moms, and medical providers. We need to have these conversations as often as possible. We need to have them in hospitals. We need to have panel discussions right along in the hospital with our own providers, so that way we can get them involved. We need workshops, the same way when you're working in the hospital and they have diversity trainings and all these things to learn the lingo. We need to have trainings, more trainings, because yes, we have sexual harassment trainings and how to give dignity and respect to patients and stuff. But we do need to have these uncomfortable conversations with our providers on what is eye contact do, what is asking permission to touch, asking them what they need and really answering and listening. Like, these are the conversations we need to have with our providers, because we need you, we look up to you, and this is what we know. And honestly speaking, with the way the economy is going, our insurance pays for certain things. And a lot of times our insurance will cover a hospital bill faster than they will cover a holistic practice. So we need a lot of people, especially going through hard times, they're going to need to be able to use their insurance. And the last thing they need is to be at a doctor's office and feel like they're not being approached well, listened to. So I thank you for having this type of conversation, because even you as becoming an OBGYN, you know, like you said, you're doing your residency and they're looking at you like you're crazy because you're covering a bump, you know, like this, I'm sure they're probably looking at you like you're crazy, like now, like you're trying to become an OBGYN and you're having a whole theme on obstetric violence. I mean, hear me raw. Yes, woman, hear me raw. But this is what we need. We need our counterparts. We need a collective to get together and have these uncomfortable conversations across the board. This needs to go on YouTube and it needs to be played all the time. So that way people can hear this and see this, so we can really bring a change. That's all I got.
Thank you, girl. And then Kristen, if you want to mention anything about your obstetric violence course and resources, I would love that really quick.
Yeah, well, my chair just rolled. Sorry. I was about to say something. Yeah, so I did just release a course on obstetric violence. If you just go to birthmonopoly.com, you'll be able to find it pretty quickly. And if we have 2 seconds to talk about complaints and things like that.
Yeah, 2 seconds, go for it. And then also, everyone else, you can keep the chat and Q&A going on Hoova. But yeah, you can do your complaints.
Okay. Yeah. So I just wanted to say that just across the board, a really simple statement. There are no effective or meaningful mechanisms in place right now for eliminating, preventing, finding recourse for obstetric violence. I have spent years helping people bring lawsuits, going to medical boards, going to hospital administration, knocking on every possible door. And there is no silver bullet. These systems are largely toothless and often re-traumatizing for the survivor. And so I'm just going to make that statement and say, to second what Chantel was saying, we need to be having these conversations more and not just assume that, there is some authority in charge that, gosh, if this awful thing happens to you, you just go report it and they'll take care of it and it won't happen to somebody else, because that is not the case. So, thank you for having this conversation. And yeah, just like Chantel said, we just need to be having more of them. Yeah.
All right. Thank you everyone so much for coming. This was obviously a very heavy conversation, but it's so needed, and it is the reality of obstetrics in this country. I want to thank Kristen, Andrea, and Chantel. Such wonderful women. I feel like I've just even though this is an intense subject, I feel inspired to keep pushing against these boundaries, and I'll keep covering bottoms of women. I don't care how many nasty looks I get, because women deserve dignity when they're giving birth. They really do.
You'll
so we'll
be on the
end,
right side of history, Magdalene.
yeah, on the side of human rights.
I'm so proud of you.
So thank you everyone. We'll end the webinar, but have a great rest of the conference, please. And we'll see you in sessions right now. And then there's still another panel later today. So thank you so much, everyone.
Thank you. Thank you.
Thanks.